We begin with a worsening coronavirus outbreak here in the U.S. The Delta variant has been fueling a rise in cases since late June. The country is now averaging.
Hello, today I present to you an extremely attractive application for music lovers. It's completely free. You can listen to music online or download unlimited music to use whenever you don't have internet. The powerful search function helps you find anything you want. Trust me. It's hard not to find what you're looking for because the search function is really powerful. Application download link is attached in the description of the video. I'm pretty sure you'll like it. Thanks.
More than 110,000 new infections per day, and some hospitals are once again reaching their capacity. CBS News has learned the FDA is planning to authorize a booster shot for immunocompromised individuals this week. That's just below 3% of the U.S. adult population. And on Wednesday, the CDC updated its guidance, urging pregnant women and women who plan to get pregnant to get vaccinated. The agency says the shots are safe. Janet Shamlian leads us off in Houston.
Elaine, we are inside of a tent equipped with supplies and beds, just like a hospital emergency room, even though there is an actual hospital emergency room just outside of this tent. But it has become so full, they needed a backup plan.
Tonight, the Delta variant is devastating the South. They've put up an overflow tent outside Houston's LBJ hospital. Inside, a dozen emergency room patients are waiting for beds in the ICU.
We are challenged, we are stressed in our hospital capacity.
More than 20,000 new cases reported across Texas on Tuesday, the highest in 6 months, and spiking just as kids are going back to school. The San Antonio and Austin districts defying the governor's no mask mandate, telling teachers, students, and staff masks will be required. And 2 Texas judges ruling local officials can require masks. No more masks! No more masks! Anger spilling over in Franklin, Tennessee Tuesday outside a school board meeting. Parents yelling at medical professionals who advocated for masks.
We know who you are.
In Florida, the number of new cases is now averaging more than 20,000 a day for the first time since the pandemic started. 200 ventilators and other supplies were sent to the state from the national stockpile. Though on Tuesday, Governor Ron DeSantis said he was unaware of the shipment.
I would honestly doubt that that's true, but I'll look.
And tonight there's new guidance, the strongest yet, from the CDC urging women who are pregnant or plan to become pregnant to get the vaccine, saying there is no increased risk of miscarriage. It's guidance Jamal Chubb wishes he and wife Sierra had sooner. Sierra gave birth to a healthy baby boy 2 weeks ago while COVID positive. Her condition deteriorated, and she's now on a ventilator in the ICU. The South Carolina mom of 3 had not been vaccinated.
For us, it was because she didn't know enough, and she didn't feel confident when it came to giving the vaccine that it wouldn't hurt our child.
Chubb told me doctors are not optimistic about his wife's condition. He is.
I believe in miracles, and I believe that when I look into my oldest daughter's eyes, as she reminds me so much of her mother, that I want to be able to tell her that I did everything I could to get her mom back to her.
A tragic story. The administrator here told me that prior to COVID, the last time she had to get a mobile unit like this up and running was when she was commander of a combat support hospital 10 years ago in Afghanistan. Elaine?
Janet Shamlian, thank you. For more, I want to bring in emergency medicine physician Dr. Anand Swaminathan. Doctor, welcome. Thanks for being with us. As we just saw, some hospitals are overwhelmed with cases again. What are you seeing on the front lines?
Well, we're seeing a quite different picture because we're in an area that is highly vaccinated. And so we are seeing an uptick in cases. That is happening. We are seeing some sicker patients, but nothing like what we had in March or April or even just this last winter. It's really quite the discrepancy of what we're seeing in comparison to what I'm hearing for colleagues in Texas and in Florida and Louisiana and Mississippi, where they are completely overwhelmed. The EDs are full, the emergency department's full, the hospital's full. There are no ICU beds. I mean, there are states where there are no ICU beds left to take care of patients. And this is really related to the rate of full vaccination that we have. And it's just another reminder that if you're not vaccinated, go and get vaccinated now, because that's what's driving these cases. It's the unvaccinated group.
Well, we know the average pace of first-dose vaccinations in the U.S. has nearly doubled over the last month. Doctor, what do you think has contributed to this increase, and will it be enough to get the nation's recovery back on track?
I think there are a couple of things going on here that are important. I think one is that people are really scared, as this is really touching their personal lives, seeing friends and colleagues that are getting sick. They are being pushed to make sure they get vaccinated. And that's not the way that we want things to happen. We really want people to learn from others' experiences and push that rate higher. But I'm glad that we're seeing increased vaccinations. I feel like we could have seen this a lot earlier if all of that disinformation wasn't out there. And we're having to combat that disinformation every day. We're getting better at it. And I think that's helping to push rates higher as we're really getting in touch with people a little bit closer to home and really helping them to understand why it's so important to get vaccinated right now.
Well, a new poll by the Kaiser Family Foundation found there are significant barriers to increasing vaccinations in children ages 12 to 17. Doctor, what are some of the obstacles you are seeing?
There are a number of different things at play here. You know, I live in an area in a town where vaccination rates are extremely high amongst adults, but we're still lagging in that 12 to 17 age group. And when we look across the country, less than half of the 12 to 17 age group is vaccinated. We know that none of the under 12 are vaccinated. And so it really stresses the importance of that group getting vaccinated as quickly as possible. Now, we do see from that Kaiser Foundation information within Black and Latinx populations, there are some perceived barriers that are not actually there, things like cost, but then there are some true barriers. Things like, do I get time off? Will my job support me in taking my kid to get vaccinated? And I think what we can do to push those numbers higher in that group is to instill more confidence in these vaccines. So to message to parents why this is so important, and not just us on the national level, but the individual school districts messaging that, the nurses in schools messaging that, individual pediatricians and family doctors messaging how safe these vaccines are in that age group, how important they are to protect them. And then also encouraging more businesses to give people the time off they need to get their kids in and get them vaccinated.
Well, the CDC is now urging pregnant women to get vaccinated against the virus, citing new data. What does that data say about the safety of these vaccines and whether they impact fertility?
Well, one of the big national organizations for women's health, ACOG, the American College of Obstetrics and Gynecology, has been supporting vaccinations for quite a while now. I'm glad to see the CDC jumping on board with that as well. What we have is data from the reporting system showing that there's no increase in the rate of miscarriages among pregnant women who are getting vaccinated. And I think that's really important. And what it really states very clearly is that the best way to protect the fetus is to protect the mother. If we protect the mother from COVID, we are more likely for that mother to be able to carry to term and deliver a healthy child. So we really do need to really get in touch with that particular at-risk population, because we know COVID is worse in pregnant women. It can be more dangerous. So it's an even bigger reason to push that group to continue to escalate their numbers of vaccinations.
And CBS News has learned the FDA is planning to amend its emergency use authorization orders for Pfizer and Moderna's vaccines to allow a third dose for immunocompromised people. Doctor, who falls into this category, and why might a booster shot be necessary?
Overall, boosters are not necessary for the vast majority of people. A universal booster isn't necessary, and we should really be focused on getting those vaccines abroad into other countries, getting more people vaccinated. But we do have good data saying that immunosuppressed, really highly immunosuppressed people are at an increased risk because they're not able to mount as robust an immune response from a 2 vaccine series. So this really includes people who are on strong immunosuppressant medications, those with solid organ transplants, so kidney transplants, liver transplants. Those groups really should get that third vaccine. So I'm glad to see this messaging coming across. It means that we can increase safety for that group. And remember that those solid transplants, those immunosuppressed people, they're not just adults. Many of them are children as well. They're in that teen area where we can get them vaccinated. We can get them that third vaccine, get them back to school in a more protected manner. So this is important messaging from the CDC. And again, stressing that universal boosters are not necessary right now.
All right, Dr. Anand Swaminathan. Doctor, thanks very much for sharing your insights with us.
Thank you.